Note here that the following lecture would be a basic discussion on antimicrobial therapy and cardiovascular support pertaining to the management of sepsis and septic shock. Sepsis is a life-threatening condition that arises when the body's response to infection injures its own tissues and organs. Sepsis is also known as blood poisoning, bacteremia, and septicemia. Sepsis is caused by an immune response triggered by an infection. The infection is most commonly bacterial, but it can be from fungi, viruses, or parasites. Now, let's get to discuss therapeutic choices, resuscitation and monitoring. Meticulous monitoring of the patient's circulatory volume and ventilatory status is essential, with immediate resuscitation if required. If simple measures do not quickly restore hemodynamic stability, it is important to consider intensive care with invasive hemodynamic monitoring and aggressive cardiovascular support. Glucose control. Despite conflicting results in recent studies, it is prudent to maintain euglycemia in septic patients. Intravenous regular human insulin can be administered by continuous infusion with a glycemic check every hour. Initial antimicrobial therapy is empiric because gram-positive, gram-negative, mycobacterial, fungal and viral sepsis are often clinically indistinguishable. Antibiotic selection is based on the most likely source or site of infection and hence the most likely causative microorganisms and the anticipated susceptibility profiles. Candida is the fourth most common pathogen isolated in bloodstream infections in the intensive care unit. Yet, when to start antifungal therapy is not clear. In special at-risk populations such as neutropenic patients, empiric antifungal therapy should be considered. Other patients need to be considered on a case-by-case basis. Initial antibiotic selection is only a suggestion, and all antibiotic choices should be based on local antibiograms. Antibiotics selected should cover as close to 100% of probable pathogens as is reasonable, and yet should be as narrow in spectrum as possible.